Hi, I'm Matt Sawyer. I'm a GP in the northeast of England, and I spend a lot of my time and energy thinking about climate action, decarbonising primary care, and really thinking about why do we do what we do? Why should we bother doing something different? And what can we actually do to make a difference, both to our patients, to our practices, and to the population, as well as the planet at large? Well, actually, there's a lot of harm being caused to patients from the natural world, from the environment that they live in, really because of the way that we are living our lives, how we're delivering healthcare, and there's huge amounts of gains that we could be making for ourselves, our families, and our patients, and the wider population if we did things a bit differently. There's air pollution, for example, a lot of deaths in the UK from air pollution. There's a report that was out just recently looking at 1 in 6 deaths globally are caused by pollution. And we know that climate change and the climate crisis is going to be something which is going to affect a huge number of us. So actually, as part of my non-clinical work, I start thinking about, well, what's the easiest way for practices to understand what they're doing and how they're doing it in terms of the environmental impact, and then what can they do about it. So there's been a development of a carbon calculator tool that practices can use. It's free, gpcarbon.org, and practices can put in their own non-clinical carbon data into it. It's very quick, very simple. The web address at the bottom of the screen has got a walkthrough video to show you exactly how to do it, and it gives you your practice's carbon footprint. It's saved on your computer, so nobody else gets to know about it unless you want to share it. From there, it's one thing measuring what our in this case, greenhouse gas emissions or our carbon footprint of our practice, but it's then knowing what to do about it. So some of the work that's been going on is looking at, well, how can we decarbonise primary care, and how can we take some of the knowledge and expertise elsewhere and help practices who, let's be honest, are absolutely swamped with things, clinical things at the moment. So there's been produced a primary care non-clinical decarbonisation guide that is there really to try and help practices with a logical and a methodical approach of doing exactly what they're doing at the moment, just a little bit differently to reduce some of those impacts. So really the overall aim is, well, how can we improve patient care, patient health? How can we improve staff health, staff well-being, recruit and retain our employees? How can we reduce the costs financially to our practice? How can we benefit the communities that we serve and look after? And how can we do all of these things but with less environmental impact? So one obvious option is looking at the way that we are transported, either ourselves or our patients, or the goods that we buy to and from the practices. So we know that carbonised transport produces air pollution, which affects health. We know that active transport, walking and cycling, can improve staff health and well-being. It can improve patient health and well-being. And certainly with fuel costs at the moment, anything to get people out of the cars actually puts more money into their pocket as well. So there's a lot of co-benefits about, we still get patients to the practice, we still get staff to the practice, but we do it in a bit of a different way that actually benefits patients, practices, practice staff, populations, communities that we live in. There's also training, so there's things like carbon literacy training for primary care for practices, and this helps practices to understand where they are, where the health service is at the moment, what the net zero ambitions of the health service are, and how we might be able to help meet them in primary care. And really there's things like carbon literacy have taken place over many practices, and there's this huge value about collaborating together and having that sort of peer support, the other people who are doing the same sort of thing, and having ideas on it, rather than doing these sorts of things in isolation. So very quick brief introduction. Contact details are through the website. If you want to drop me a line, know a bit more, visit it. There's lots of free resources there, lots of videos, slides, all sorts of other things. Make use of it and drop me a line if I can help. Thanks. Bye for now.